Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. So welcome to the Healers Café. And today I have Jorge Padron with me, and he has been 12 years of healthcare, or has had 12 years of healthcare experience in various areas such as ICU, trauma, and psychiatry. He trained in psychedelic assisted therapy in California Institute of Integral Studies and ketamine therapy with Dr. Phil Wolfson. And currently he's engaged with AW Psychedelic Training Program. And I think your history is basically combining medication management with holistic care, such as talk therapy and the use of these alternative therapies like ketamine assisted psychotherapy. So welcome.
Well, it's a pleasure to be here, Manon.
Yeah, so my usual question, because it's just my curiosity, what brought you into this? I mean, maybe nursing first, but what brought you to this, particular aspect of healing?
Hmm. That's a good question. And it's actually been kind of a varied road. I started when I was 17 with an EMT certificate. And then by the time I was 18, I was a paramedic. Uh, from that on, I continued to study it, of course. I always had a passion just for helping people, and that kind of changed over the years. Now I mostly do psychiatry, but mainly I started more with a physical approach, and then from that approach, I moved on more to mental or a mind model, right? So I do combine a lot of the knowledge I've gained along the way, but most of the time, I feel like everything kind of informs each other, right? Like, so the physical body and our mind are very correlated to a point that, obviously if you're sick physically, that will affect your mind, and sometimes vice versa, or a lot of times vice versa. I've seen it go both ways, right? So when I was working in the ICU, which is really what led me to pursue psychiatry, I saw how many mental health issues were untreated and were leading to issues with long-term health, right? You have someone that they tell them, hey, you keep eating this way, you're going to die. Yet they're unable to satiate themselves with their life or anything else, and they will literally eat themselves to death, or they will participate in behaviors that will shorten their life significantly. Yet these people don't seem to have a control over this, right? They use a lot of these maladaptive mechanisms to emotionally support themselves, and they shorten their lives. They rather have a shorter life than stop doing these things, right? So that's really what led me down the path of psychiatry and mental health.
Mhm. And so in describing like the person who most benefits, like what is it that this combination, which is, partially talk therapy, and I would imagine presence, hearing what's going on for people, plus the ketamine therapy, like who are the people that most benefit from that? And
So
could you
most
explain also ketamine? I mean, just for those who may not know what it is, if you could just say a little bit about it as well.
Yeah. Well, we'll start off with ketamine, and ketamine is one of the only legal psychedelics. We really call it a psychedelic, really, because it has psychedelic properties that we have here in the United States. We are having, of course, some movement on the fronts. Oregon in the United States did approve psilocybin, which is the mushroom therapy, and Colorado has decriminalized a lot of plant-based psychedelics. So obviously, legislation is changing. But for now, ketamine widely in all of the states is that that substance that a lot of people can have access to and doctors can prescribe. So a lot of times when we are looking at a lot of these substances, it's really an issue of access, right? So if we do not have enough access, it really damages or it severely shortens how much population you can reach, right? So ketamine has a wide reach because it is a substance that also doesn't last very long. So it will mostly stay in your system for an hour or so, or an hour and a half, depending on the formulation that you use. And it makes it so the clinician can easily treat the patient, unlike some of the other psychedelics that last a longer time, right? So if you do something like mushrooms or psilocybin or anything like that, you're going to be looking at 6 to 8 hours, and then there's a long period of comeback, which makes it very hard for providers to commit that time to just one patient, pretty much one day for that patient. As it is in mental health, there's just not enough providers already as it is. And then if you add a combination like this type of therapy, that's going to significantly impact. I just wanted to give a little bit of background on the therapy. And now I will explain who this is for. Although now it is being billed as it's a cure-all for everything, as we know, that's not really the case with any substance, and you shouldn't use a substance as, oh, this substance treats everything. It is the new kid on the block, even though it's an old medicine. So a lot of people are jumping to it as the first line treatment or the in vogue treatment, right? But the reality is the people that are going to benefit from this are people that have tried antidepressants or other modalities and haven't had any relief from them. Maybe someone that's looking for rapid reduction in their depressive symptoms, right? It doesn't work so well for anxiety, and one of the reasons being, of course, a lot of people with anxieties have issues with control. And then you have a substance that basically gets you don't have control, because once you take it, you know, to some degree, you are having a journey where you're really going into deep regions of your subconscious mind. And that will, to some degree, be scary to some people, right? So the right patient is mostly looking at someone that is well-informed, that has tried other therapies, and that is trying to just have a rapid reduction in symptoms, but is also someone that doesn't have certain conditions that would preclude them from therapy. One of them being hypertension. Even though it's a sedative, ketamine actually does increase heart rate and blood pressure. So someone with uncontrolled heart rate or blood pressure, you really is not inappropriate for that session or for that type of treatment. And also someone that has thyroid issues that are not treated. If they're treated, they can have that type of treatment, but if they're not treated, you really shouldn't, because it could really dysregulate the thyroid.
Mm. Now, from what I understand, it's used also conventionally as an anesthetic, or also as a painkiller. But with its duration being, an hour or so, what is the therapy that reaches people? Is it like a subconscious work, or what is it that, like, I'm just wondering, pain syndrome, complex pain syndrome, which is multifaceted, and from what I've researched, the origin of it is very hard to tell. You get to name it that eventually, but nobody really knows how it got there. Is that the type of therapy that would be useful?
Yes, it is used in people that have intractable pain or chronic pain syndrome. And the reason for it was, even though the initial effects are short-lived, actually the biological effects, it causes a cascade, right? So because it's what we call a drug that doesn't act just on one receptor, it mostly actually acts on glutamate. What it's actually going to do is actually going to create more, there's going to be other neurotransmitters that are going to come into play because of the use of this. And this can last up to the weeks. The effects, really what we call sometimes the afterglow, or really those effects, people might feel good for up to a week, especially the first couple of times where the brain is not used to it. Now, of course, in the news now, there is issues, as you saw, the famous actor, unfortunately, Matthew Perry, died from a ketamine overdose, and that's very big. So a lot of people are finding out about ketamine now from from this negative side effect and unscrupulous practices, right? Obviously, there was some issues, not just ketamine. It was also just not really therapeutic levels of the substance. So that's in regardless. But to go back to your question of pain, so the other effect, which is psychological, is if a lot of people, not just with depression or anxiety, but even with pain, identify with the pain. So you say, my pain, I have chronic pain. The moment that you've identified with something, it's a lot harder to get rid of it, as we know. And ketamine is very good at getting you to observe your pain without necessarily identifying with it. So it's almost having that a lot like a mindfulness or Zen moment that where you have a timeout. Phil Wilson, who trained me, actually calls it a timeout. It's a timeout where you're observing your body, your pain,
Right.
but you're not necessarily identifying with it. And that is huge. Psychologically, that's huge because it gets to show you, I'm more than just my chronic back pain. I'm more than this pain that I've had issues. That I've had issues on and off for the years, and now I'm more than this. And that gets people to kind of have a little bit of a distance from them. That is hugely beneficial from the psychological perspective, aside from the biological effects it has.
Mm-hmm. And have you found that, I guess it could be a combination of both, the psychological and biological, but that it can be used as this is a word we're not supposed to use, but curative, in the sense that you can actually, either by being the observer and therefore not directly identifying with it, but also the cascade of neurotransmitters that would come in taking this maybe a few times. Is it possible then to change the biology that way? Like, does it make sense that you could potentially then be free of pain?
I've seen a lot of people make great strides, but no substance actually is curative, and that's something that we have a hard time in our consumer society actually addressing, right? So the reason that what a cure really requires that the person actually change something about their life that was happening to some degree that actually creates a totally new environment. It doesn't mean that they need to move towns or anything like that, but something about them has fundamentally changed. And that's when you really see the biggest changes with this substance and with any other substance. Because there's a lot of people that do use these substances, and to some degree they experience what's called a poop out, we call it, unfortunately, like it stops working, right? It just doesn't, like, the substance no longer has that beneficial effect. And now the person is even in a more desperate situation because something that they finally found working is now no longer working. Where you usually find that is the person relied too much on the substance. And this could happen with any other psychedelics. It could happen with anything, really, where the person, and you see this is unfortunately a really big issue in the psychedelic sphere, where people will say, well, the medicine told me. Well, okay. But the reality is your mind is also coming into play with this sacred substance, whatever you call it, whichever one of these substances. So most of the healing is being done also by these other parts of your mind that you're not used to exploring. And yes, the plant may have its own consciousness. We might not get into that or whatever, right? Of course, I go on to many different cultures where they really do have this belief that the plant has its own consciousness. Ketamine, to some people would even say, has its own the ketamine space, they call it, right? And some people call it to be very, very much something that you go into when you use ketamine, right? Compared to other substances, right? But really, you see that when people get so enamored with the substance, that's when you see negative effects. If someone can actually use the substance as a teacher or as a step along their journey, then yes, it can be a step in the curative journey, but it is never the entire journey. And that's what so many people have a hard time accepting with any of these substances.
Yeah, no, I think I would, it's not my specialty, but definitely I would concur from the patients when I had a practice. I would agree with you. Yeah, it has to be within a context of which wanting to become aware is part of the journey, you know. At least that's how I see it. Yeah.
Yes.
Well, so with what's happening these days in the world, and there's a lot of neurological
Mm.
issues that have uh, come across or that have manifested uh, as either side effects or latent possibilities within people. Have you been able to help those or address those kind of issues?
Yeah, and strangely enough, that doesn't always require ketamine or anything special. Sometimes addressing those issues just requires really caring and showing someone that, you're there for them in a way that a lot of times is hard because we are very much in the business of patient satisfaction or satisfaction of the problem with that happens that people, if you knew what you needed to do to get better, you would have probably done it. Most people are intelligent enough. But the problem is a lot of providers, I think, are afraid to say the hard thing because sometimes it's a word that helps the person and not so much a substance. It's telling, hey, but really, how many times are you going to run away from this problem? When are you going to address it, right?
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
But, a lot of times we live in a society where there's reviews out there and things like that. I normally I get along great with my patients, but I always tell them right before they start treatment with me, I am hard. I will tell you the thing you don't want to hear if I think you need to hear it. And that's how really you help people, by being honest, by instead of caring so much about, oh, wow, they told me everything I want to hear, so I'm going to go to them and just spend 20 years on the couch and feel great about myself. Therapy isn't about feeling great, because if you're feeling so great in therapy,
Mhm.
there's probably not much hard work going on, right? So therapy sometimes can feel very good, especially when you meet your goals and you get better. But a lot of times it could feel very hard and it can be daunting because the things that you need to do are out there in the real world, not on the therapy couch.
Yeah, yeah,
And that's
yeah.
how I help people.
Yeah, that's funny because that reminds me a bit of the reputation I had too. They would say, well, if you want a real opinion, go see her. She'll tell you at least my opinion, but it's like you don't hold back because it's a truth. It's not the truth, but if I'm aligned with it and they resonate, there's a chance for healing to take place. If you act like a people pleaser, it'll never work. So, and that's for any type of therapy, I would think.
Yeah.
Yeah.
But
So
it's very
what,
hard.
yeah. So what, are there, without names, of course, but are there, um, cases that that really affected you or moved you or, for people who are listening and going, wow, I missed this. I need to look into this. Like, what can you share that, where you see that this work fills a unique um, need or, or a solution to a problem that other therapies may not reach. You know, I mean, everyone chooses their door, and, you know, it's not about knocking anyone, but it's, you know, sometimes you have a sense that this is really perfect for this type of person.
So I have had a lot of success with people that have experienced trauma, or people that have experienced severe difficulty with maybe loved ones dying and grief. And one of the reasons you could attribute this is one, if we're talking about ketamine therapy, which is just a subset of what I do, it's not all of what I do. But if we're talking about that, because we're on that subject, ketamine seems to have this real effect on, it does almost very, it's almost like a near-death experience. It's very, very similar if you use the correct dosaging. So it's not like the person thinks they died, but very close to it. So there's a lot of ego suppression. And this causes a lot of almost like a life review, very similar to what people have called a life review in near-death experiences, right? So because it triggers this in the mind, it's able to really review traumatic events or even the death of a loved one, and see it in different perspectives. See it as like, oh wow, I can finally say goodbye, even if that person is not no longer there. You're not going to be able to really say goodbye to that person, or we don't know, right? But at least in your mind, you've come to peace with it, because a lot of it is where this therapy is really good, is coming to peace with something that you've struggled with a long time, right? So it's really good with that. And you know, I don't like to say too much about my patients, because sometimes they do listen to the podcast and things like that. So I don't like to say too specific things. But what I do feel is when people have specific events that have marked their lives, it's really good at addressing that. Now, also when people have issues with letting go of control and you know, OCD like behaviors, is really good for that. Because I've had people that I'm like, oh wow, I let go and I came back, and the whole world is burned down. And it gets them to trust, right? Because so many times people build up the walls because they don't want anything getting in, but then you can't get out either. So now you're trapped in with all your, you know, 20 feet walls you built up. So the world can't get in, but you can't get out. And where people stay stuck, it's really good at breaking those barriers.
Yeah, that gives a very good, yeah, for me, a good understanding of it. And the analogy is exactly, it's perfect. It's true. You know, you build the walls, but then you're stuck inside, you know, so yeah. Very interesting. So what other therapies or what other work do you do that you're enjoying in your practice, or that you see is complementary or?
So really my therapy style is a combination of many different ones. So one of the ones that I'm really enjoying is just having people really, I have a series of exercises that it gets them to talk to themselves without necessarily having to use a substance or anything like that. And one of them, I call it Coffee with a Friend, where basically, you know, most of us drink coffee or tea or something like that, but most of us never check in with ourselves. And you're going to see that, you know, we of course always recommend to people, hey, meditate and do this and that, but that's just something else they're going to have to do. And if you're busy enough, that's always going to get pushed back. So I really recommend to a lot of my patients, and I've gotten very good results from it. Just sitting there for as long as it takes you to sip your coffee or drink your tea or whatever you're going to have in the morning, or maybe, you know, in the evening, or whenever you have the time for that. And basically pretending there's another version of them right across from them, and they're going to just tell them about what's happening in their day. And they're just going to say that, and then they're going to leave a 2-minute pause and see what comes up. And usually in the beginning, it's nothing. But over time, people are surprised that they start talking back. Not in a, you have to be careful where you do this, right? You don't want to do this in public and then have other issues. But really, you see how much of a difference that makes for people. So I really really enjoy having people get back in relationship with each other, and trying to remove myself even from that process. So I will give them the technique, then they'll do it on their own. They'll bring back whatever they saw, but people start to actually help themselves to a point that you're really just letting them go. You're kind of taking off the training wheels, and you're seeing how much that person actually does know what to do to make themselves better, but they just never asked, right? Because
Yeah.
a lot of people say, it's like, oh, I want to be at peace and I don't want to be anxious. I don't want to be depressed. Okay. Do you know what you need to do that? Oh, no, I have no idea. Have you ever asked yourself? No. Why would I ask myself? That's already coming from a supposition, right? And then, of course, this very same person takes ketamine or takes a psychedelic or takes a mushroom, and then all of a sudden they're having this mystical experience where they just know. They just automatically know what they need to do. And it's actually true. They do that and they get better. But what really happened? You just remove the ego from it. And now you're having a conversation with yourself. You could call it the mushroom or you could call it whatever you want, but you're having this conversation with yourself with no judgment. You've removed the critic, you've removed the inner critic and the ego and the PR manager. The ego is the perfect PR manager trying to make sure that, you know, everything is under wraps. And then this person gets better. But what I'm trying to teach people is like, you can do that without a substance. If you make that a part of your life, you will always be able to honor your intuition. But if you don't do it, it's like, you know, you're going to be with yourself for, let's just say 80 years of your life. And you're never going to check in with yourself. You're just going to believe what everybody else is telling you. What if what they're telling you is not necessarily good for you? And you only really know that if you know yourself.
Yeah. Yeah, I so agree with that. I mean, it's such a fundamental part. Because part of my practice was doing this physical therapy. So people would come in with, frozen shoulders or TMJ problems and rather than go, their attitude was like, okay, fix me, right? And yeah, it can be done. But I always ask, why do you want to get better? And it's like, they look at me like I must be mocking them, but I wasn't. I was seriously asking the question. And those who could go there, I know that it changed the way the treatment was received. And I know that they reached much deeper depth of healing than if I had just said, okay, get on the table and, we'll do our magic or whatever. It's the context of healing is huge, so I think that's the conversation. And when you say the conversation with self, I mean, we're in society where we're trying to have a conversation with a doctor. That's already something. But to have a conversation with oneself, you become your second best opinion, right? And it could be the best opinion. That's the thing, right?
Yeah.
Yeah.
I always tell people, listen, I may be an expert in whatever I do, but you're an expert on you. So there's always two experts whenever you're treating someone. You are bringing your expertise on how to heal them, and they're bringing their expertise on themselves. But when they don't bring it up, there's a missing component, right? And I asked a very similar question. It's a little bit more direct, but I said, well, are you ready to do what you need to do to get better? And they, of course, always say, of course. And I'm like, no, are you really? Because then the moment that you say, okay, well, don't do that anymore. Don't do this. Okay, we're going to do that. They're like, whoa, I can't do that. That's not the way I function. Well, then how are we going to get better, right? It's all about that. But I do think people are more aware nowadays than they were before, and people are being more empowered. So I really like that. That trend is towards really trusting yourself a little bit more. It becomes a problem where, of course, the medical or even the professional healing organizations are losing a lot of public trust, and it's just because people feel a disconnect there with them. And unfortunately, we should mend that. But one of the ways to mend it is to really come to the table and honor the patient experience, honor the person's experience.
Absolutely. Yeah. I think it's more transparency, more connection, more dialogue, not the opposite, not just trust authority. And that's definitely going the wrong direction, which, parts of our society would like to go to, but I don't think they're going to win.
Yeah.
I'm very optimistic. And anyway, if we create a parallel that is fundamentally more aligned with people's consciousness, that's what will happen, right? It's really, everyone has to take responsibility for their part, so. Anyway, last words to you, because we've already done our time. So
No, yeah. I mean, it was a pleasure. Thank you for having me. And I just would encourage everyone to really maybe try coffee with a friend for themselves and see if they have something to tell themselves, you know. And it's amazing what they might find. You know, you don't have to write it down or anything. Make it casual. Eventually, you might want to write it down, but you owe it to yourself to have that conversation at least once in a while. So I would always encourage people to go ahead and do that. And you could do it over your favorite beverage. So it's not like it's got to take any more time out of your life.
Well, thanks very much, George.
Thank you.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.